Okay, so hello again and good morning. My name is Michele Grand. I'm a licensed massage therapist and I work at Smilo Cancer Hospital. Today, we're going to be talking about acupressure, and we're going to be working on points that will benefit us when we have colds, flu, sinus pain, and allergies. You're familiar, I'm sure, with acupuncture and the points along the body where the acupuncturist would place the needle for benefit. Well, acupressure works in a similar way. We're working with the same points, but instead of the little needles that the acupuncturist would use, we're using finger pressure. So acupressure describes any type of massage that stimulates pressure on the body to achieve a therapeutic effect. Acupressure was originated in Asia thousands of years ago, but only really took off in the 20th century. And at that point in time, it spread throughout the world. Acupressure uses points that lie on meridians. The meridians are invisible lines that carry chi or life force energy throughout the body. When a meridian is blocked, there is an imbalance. It could cause discomfort or it could cause illness, but it's an imbalance. And when I say a meridian is blocked, it could be blocked because there's too much energy there or there's a deficiency of energy there. Ultimately, the goal of acupressure is to restore health and balance to these bodies' channels of energy. There's negative energy and positive energy, and that's the yin and the yang in the body. The acupoints themselves are about the size of the pad of your thumb. And when we start working on our acupoints for today, you may feel when you hit right on that point, you may feel a little nervy sensation or a little soreness. And that's when you're right on the point. But if you're in the vicinity of the point, you're going to still get that therapeutic effect. Now, the pressure that we're going to use when we work on our acupressure points today, it's a sustained pressure. And usually a circular motion, a pressure with a circular motion on the point is going to give you the release that you need. Typically, anywhere from 1 to 3 minutes of stimulation is going to generate the effect that you need. Today, we may not get to a full 3 minutes on each point in the time we have allotted, but just know when you work on these acupressure points at home, you want to be there for at least 1 to 3 minutes if possible. You also want to stimulate both sides of the body. Our meridians, they are on both sides of our body, going up the arm to the head and going down to the legs. And then we have one meridian that goes to the front of the body and one goes down the back of the body. The overall benefits of acupressure to us are that they could boost the immune system. They could release endorphins to relieve stress and pain, restore harmony and balance to the body. It could promote self-healing and wellness. It could improve our emotional health and our physical health, our skin tone, and our appearance. Now, again, talking about the meridians, acupressure uses the specific points, like I said, on the meridians or channels, and there are these invisible lines that carry the chi or life force throughout the body. If you can imagine the meridians as kind of rivers of energy, then the acupoints are like small either pools or dams in a river. And sometimes those pools get too full, and at other times they get too empty. So by applying pressure, we can sort of regulate the flow so that the rivers run more smoothly. Now, there are 14 meridians, and sometimes you may hear them referred to as channels. There's the bladder, the governing vessel, the gallbladder, the heart, the kidney, the large intestine, the liver, the lung, the pericardium, the conception vessel, the small intestine, the spleen, the stomach, and the triple burner. Now, these meridians are not the organs themselves. They're just channels, meridians of energy, and that's what the 14 of them are. As we begin to work today on our acupressure points for our allergies and sinus, colds, and flu, I just want to ask you, please, to just try to relax in a comfortable position. And as we work, we want to maintain our breath. We want to keep that breath flowing. Sometimes when we're concentrating or focusing on something, we tend to get a little rigid and hold our breath. So we just want to remember to keep the breath flowing. When we stimulate the points, we're going to be using our fingers today. Some people, when they practice acupuncture, or if you have an acupressure, or when you have somebody perform acupressure on you, they may use even their elbows, sometimes even their feet. But today we're just going to use our fingers. It's going to kind of be like a rotary motion, an up and down motion for, like I said, several minutes. Sometimes in acupressure, to find the point, you may hear the term soon. It's written C-U-N, but it's pronounced soon. And that's a measurement point for where the acupressure point is relative to a part of your body. So 1 soon is the pad of your thumb. 2 soon would be 2 fingers across. And 4 soon would be the equivalent of 4 fingers across. So we'll just keep that in mind as we go ahead and we locate the points we're going to be working on today. The points we're going to be working on for allergies then are going to be large intestine 4 and large intestine 11. For sinus, we're going to be working on bladder 2 and large intestine 20. For colds and flu, we're going to be working on stomach 36 and stomach 40 and lung 7. And finally, just for cough and chest pain, we're going to be working on small intestine 1. Now, as everybody knows who has allergies, the symptoms are nasal congestion, sneezing, some clear nasal discharge, itchy red eyes. And the most important thing to remember for allergy release is that we want to focus on the large intestine 4 and 11. So I'm going to show you a little chart here. Now, large intestine 11 is going to be on the side here, the thumb side moving up. So large intestine 4 is going to be here, and I'm going to explain exactly where the point is. And large intestine 11 is going to be here, but it's going to be on the thumb side of your hand as we work. So we're going to start with one hand, and then we'll move on to the other. For large intestine 4, it's located between the first and second hand bones, again, on the thumb side, and you're going to feel it right in the middle here. It's a little bit closer to the second hand bone, but it's right in this spot here. Now, this is contraindicated for pregnant women. So if anybody is on today that may be pregnant, this is a spot you do not want to press. But otherwise, just take your thumb and just feel around right in here. You may get to a spot where it feels a little sensitive and a little nervy. But just go ahead and take your thumb and give that some pressure. Little circular motions. Again, you may feel a little closer to the bone of the second hand, of the second finger here. And continue your breath. If you feel sensitivity, the pressure you want to use is that as if you were taking your pulse. If you feel a drought there and a lack of sensitivity, you can go ahead and you can use more pressure. And keep the breath going. If you prefer to use your index finger, go ahead and use your index finger. Now move around a little bit, just make sure you feel around till you get to that spot, right where the right where the bones meet of the first and the second finger. So again, right here, you have the bone of the thumb and the bone of the index finger. And right in here, at the base of the two bones, could be a little closer to the second finger. That spot right there. And just make circles. And breathe. Keep the breath going. Good. Excellent. Very good. Hopefully you're starting to feel a little bit of that release. And remember, this is something you can work on at home, and you can spend a full 3 minutes on each point as you feel necessary. But right now, we're going to just move to the other hand. If you've been on the left hand, we'll move to the right, or vice versa. And again, we're going to hone in, and we're going to find that spot between the thumb bone and the index finger bone, right in the middle here, and just see if you could feel that little nervy spot. One side you may typically find is a little more aggravated than the other side and needs a little bit more attention. So you'll know as we move along whether one side needs a little bit more pressure or a little bit more time. But just go ahead and use that pressure, whatever's most comfortable, your thumb, your index finger, little circular upward motion. Excellent. And keep the breath going. If anybody has any questions as we go, you can use the chat function, and I'll be able to address whatever questions that you may have. Use your breath. If you feel the need for more pressure, go ahead and use a little bit more pressure. And see if you start to feel release. You may feel a little warmth throughout your body. You may feel your shoulders start to drop, and that's good. That's a good sign of release starting to activate. Excellent. Now the next point we're going to work on is called large intestine 11. And again, it's on the thumb side of your arm here. And it's going to be the crease. You're going to find the crease of your elbow. And the point is actually located halfway between the elbow crease and the elbow. So you have the crease of your elbow here. And the point is going to be halfway between the crease and your elbow. So it's going to be right about here. Right about halfway between the edge of the crease of your elbow and your elbow. Right there. And when you press in again, you may feel that little bit of a nervy sensation. And if it's sensitive, don't give it too much pressure. Again, about the pressure as if you were taking your pulse, not too much. So just go ahead right here between the edge of the elbow crease and the elbow, right about here. You may feel that little bit of a nervy sensation. That's good. You know you've activated that point there. And be as gentle as you need to be with this acupressure. If you happen to have any open wounds, you don't want to work on any points where the skin may be broken. Yes, it's absolutely okay to rest your hand on a table. If you feel it's tensing your upper shoulder or your arm when you're working, it's absolutely okay to put that at ease. You just don't want to tense it. You don't want to put your hand on a table and kind of lean into it and tense it. You want to be in a very relaxed state, but it's absolutely okay to support yourself on something. But just keep your whole arm, your whole wrist, your whole shoulder at ease. And breathe. Of course, keep the breath going. And just keep the pressure on there. You could expand the area. Again, the entire point for release would be about the size of the pad of your thumb. So again, hopefully that's a little easier to see. You have the edge of your crease and you have your elbow. So somewhere right in the middle there, you'll find the point. You don't want to be on the bone. You want to be on the soft tissue adjacent to the elbow bone. So not on the hard spot. You want to be in the soft area, right about over here, between the elbow crease and the elbow, right about here. You feel the soft tissue and you may feel that little nervy spot there. Just give that some circular pressure. And as I said, if you're about the size of the pad of your thumb, you're going to activate that point. So don't worry if you're not exactly on it. That's okay. Because when you're going to do a motion like this, a circular motion like this, you're touching it and you're activating it. And when we do massage, we are often automatically releasing the acupressure points just because we're doing the entire body. So the release is happening. So don't worry if you're not sure if you're exactly on the point, because if you're here, if you're anywhere over here, you're getting the release. Okay, now we're going to move on to the other side of the body. And again, we're going to go into the area. This is large intestine 11, and it's located halfway between the elbow crease and the elbow. Yes, if you're feeling a little lightheaded or nauseous, be sure you're doing two things. Be sure you're taking breaths, because you're releasing a lot of energy. And if there's congestion there, you are opening things up. And if there's a little bit of a drought there, the chi is entering into the meridian. So drink water. If you could just step away from the computer and get some water, definitely take some sips of water and continue the breath going. The lightheadedness could be a little bit because maybe you're holding your breath a bit. So those two things are very important. Keep the breath going and get yourself a glass of water. When we're finished with the session today, you may even just want to close your eyes and just rest for a little bit too, because this is a release. So again, here, we're between the crease of the elbow and the elbow bone itself. And it's right about over here, halfway between. Just give that some pressure and breathe. Again, if at any time while we're working, if you really don't feel well, you can just stop working and just kind of listen, because sometimes maybe your body is just not prepared for this kind of energetic work, and that's okay too. So just listen to your body. If it feels like, you know what, this isn't feeling good right now, it's too much, just take a little bit of a break. That's okay too. This program will be in the Yale Cancer Center Integrative Medicine video archives, and you can always refer back to it at another time. So again, right in here, right between the crease of the elbow and the elbow bone on the soft tissue. And breathe. Excellent. Okay, good. So now we're going to work a little bit on those sinus pain points. There are points, these are points on the face, and they help to drain the sinuses and hopefully open things up and maybe release a little bit of that headache pain. So I'm going to take off my glasses. And the first point we're going to work on is called bladder 2. Bladder 2 is located at the medial end of the eyebrows. So the point would be right in here. Again, you can use your thumb or you can use your index finger. And you want to use relatively gentle pressure over here. You know, again, that pressure as if you were taking your pulse would be appropriate for this spot. So please keep the breath going. If you feel a little lightheaded, a little uncomfortable, again, take a glass of water. It's okay to stop and pick this up another time. And continue to breathe. So again, it's the point right here at the medial end of the eyebrows. You could do both at the same time. You could do one at a time. It's up to you. Whatever is your preference is fine. You may feel a little tenderness in here. And move around a little bit. You could take your thumb, because again, that acupressure point is about the size of the pad of your thumb. So don't hesitate to just move your thumb around and use that pressure for release. And continue the breath. Good. Excellent. And again, later on your own time, when you feel you want to release, go ahead and spend anywhere from 1 to 3 minutes on that point. Now we're going to go to large intestine 20, which is about a half a soon from the nostril. It's right next to the nostril. So if soon is about 1 pad thumb across, it's right about here on both sides of the nose, right next to the nostril, right in there. And again, move around a little bit for greater release. And breathe as you work. Breathe, relax your shoulders. And again, you could rest your elbows on your knees or on a table so you don't feel like you're up in the air. The whole, you want to be as relaxed, and you want the muscles to be as relaxed as possible. Breathe and work this point. Again, this is large intestine 20. Could feel a little opening going on, hopefully a little blood flow moving up to the head. Good. Let's keep that going. Little circular motions. Good. Excellent. Press and hold. And breathe in. And let it go. Excellent. Good. Now, finally, we're going to work on some areas that correspond to colds and flu and cough and congestion. Now, we worked earlier on large intestine 4, and we worked on large intestine 11 as well. Those points are also good for cold and flu. In addition to that, we're going to work on a couple of points in the stomach area. So the stomach meridian goes, it starts at our head and it starts at our head here and it comes down and around and it ends on the foot, actually it ends right here on the second toe of the foot, but it comes down the lateral side of the body and crosses over to the front of the foot. But the points that we're going to be working on today are stomach 36, which I'll show you on my body, and stomach 40. So those 2 points are below the knee, between the knee and the ankle. And I'll show you as we go along. So I'm going to move my screen down. And stomach 36 helps to boost the immune system and energy levels. And stomach 40 helps to resolve excess mucus throughout the body. Now, to find stomach 36, it's 4 soon down from the top of the kneecap, and it's along the outer border of the shin bone. So we're going to take our 4 fingers from below the kneecap. We're going to take our 4 soon, and we're going to find the point right here. And it's on, again, the outer border of the shin bone. And here, this tends to be a stronger muscle, so it's okay to use more pressure here. To your comfort level, if you start to feel discomfort, you can ease up a little bit, but generally this point can take more pressure. You can even take your fingers, your 3 or 4 fingers, and then your other hand on top of those fingers and just press in. Circular motions up and around. Again, this is the stomach 36 point. And continue your breath. You may, as you use pressure, you again make you all of a sudden, oh, I feel a little nervy sensation there. So you know that's when you're right on the point, but it's perfectly okay and to your benefit to work a larger area. This is stomach 40. This is stomach 36. Up and around. Again, you may feel some blood flow. You may feel a release going down to your ankle. And that's good. That's a good release. That's a good opening of that meridian, of that stomach meridian. And continue your breath. Good. Now, while we're on this leg and this side, we're going to go down to stomach 40. Now, stomach 40 is in the same area of this lower leg. It's halfway between the knee joint and the ankle bone, halfway between the knee and the ankle. And again, it's on the lateral outside of this leg. So you're going to move down between the knee and the ankle halfway, right about here. From the shin bone or the tibia bone, it's about 1 finger width away, one soon. It's about 1 soon away from that tibia shin bone. And again, use the whole area. Don't hesitate to go beyond the specific point because you're getting the benefit by massaging through acupressure a larger area. And again, here you may want to use the force of the second hand on top of the bottom hand for a deeper pressure. Good. And just keep that going as you breathe. Again, you may feel some warmth. Take a drink of water, take a break, take a drink of water. Excellent. Excellent. Very good. Now we're going to go to the other side and we're going to do the same thing. We're going to go to stomach 36, which is 4 soon down from the top of the kneecap along the outer border of the shin bone. And we're just going to give that pressure here. You can use one finger, several fingers, or you can use the pressure of your top hand on your bottom hand for a deeper release. Good. Excellent. And continue the breath. Excellent. Keep that going. Good. This is stomach 36. And again, at home, you continue this for a longer period of time, about 1 to 3 minutes. Excellent. And now we're going to move to stomach 40, which is halfway between the base of the knee joint and the ankle bone along the same line as stomach 36. We get to stomach 40. It's about 1 soon away from the tibia bone. Good. Keep that pressure going. Good. Make circles. Continue the breath. Excellent. Okay, very good. Now continuing on the points for cold and flu and congestion, we're going to be working on lung 7, which is in the wrist area. It's on the thumb side of the wrist. And I'll show you on myself, but it's approximately right here on the wrist area. So if you take your finger and you go about 1.5 soon from the wrist crease on the thumb side between the tendons. So we have our 1 soon at about 1/2. So you're going to be right about here. See if you could see that. Right about here. You'll feel the tendons. You'll feel the tendons, and it's between the tendons. I feel it now, you feel a little tender point. You may feel this is a lighter pressure here in this area. It's a sensitive area, and it's a lighter pressure. So using just one finger here is fine. It's also a smaller area. And continue your breath. This is referred to as the radial side of the hand. And a good way to remember radial is you think of rad, like, yeah, that's good, like thumbs up, that's rad. So I always remember radial. Radial side of the hand is the thumb side. Right about in here. If you prefer to use your thumb, it's a sensitive, sensitive little spot. So just use gentle pressure for release. And continue your breath. Feel a little nervy spot there. You may feel it right up, all the way up your thumb. And breathe. And that is lung 7. Helps with the congestion of colds and flu, sinuses, and allergies. The final spot we're going to work on, and then we'll move to the other wrist and hand. It's right on the pinky finger, right on the outside edge of the pinky finger, about 0.1 soon from the nail. So right on the edge there, right on the edge. This is stomach 1, and this is good for cough and congestion. So when you get on that spot, you feel a little sensitivity there, right on the pinky finger, on the outer edge, just about ever so slightly away from the nail. This one you could just hold, just sort of press and hold. And breathe. Excellent. And breathe. Very good. Now we're going to go to do those last 2 points on the other hand. Just move over to whatever side you did not work. Again, we're going to go to lung 7, which if you find your wrist crease on the radial side, so again, you're on your thumb side. It's about 1.5 soon down between the tendons. So you're going to be right in here. Right here. Yeah. May again feel that little bit of a soreness, a little nerviness. This is a lighter pressure area. So you can hold and make little circles or just press and hold. And continue the breath. And feel the release. Hopefully you're feeling a little flow going from the back of your throat, a little flow going, a little opening of the nasal passages, a little release. It's good. Continue the breath and spend extra time on your own here. Give it that full 1 to 3 minutes. Excellent. And now we're going to move to stomach 1, which again, your pinky finger, you have the outer nail edge, and it's literally 0.1 soon, so it's right there, right at the outer edge of that pinky finger. Yep. Go ahead and give it a little pressure. Yep. You may feel that little soreness, that little nerviness. And breathe. And breathe. Little circles. Use your thumb from your other hand and get in there. Whatever is most comfortable for you. Move around a little bit. It's okay to occupy a little bigger space. Give it that full release. Excellent. Okay, so as we conclude, I'm just going to ask you to take another deep breath in. Hold and release. And stretch your arms out as far as you can and over your head and down into prayer pose. And exhale. Wonderful. That was a lot of work for you today. And thank you so much for taking the time to think about a little bit of what acupressure is. You may feel a little soreness in the points that we worked today, and that's okay. It's like as if you got a massage and you feel a little sore after the massage. That's good. That's a good feeling. So don't worry about that at all. It'll pass within a day. So just drink lots of water. Relax a little bit if you want to close your eyes and just kind of rest for a bit, and enjoy all the benefits of acupressure today. So bless you all. Thank you. And I will see you soon. I'll be on Thursday at 1:30 doing a little guided meditation and breath work.